Today's discussion will be professional boundaries in nursing. Myself, Jennifer Baxter, and
Veronica Harden.
will be discussing the professional boundaries in nursing.
Professional boundaries are the spaces between the nurse's power and the patient's vulnerability. The therapeutic nurse-patient relationship protects the patient's dignity, autonomy, and privacy, and allows for the development of trust and respect.
The nurse-patient relationship, the patient becomes dependent on the nurse for care, becomes at their mercy. So we have to continue to be self-aware of our nurse-patient relationship, staying within those boundaries and maintaining safety above all and the patient's best interest with our care.
Social media is a problem in healthcare. It can be a situation where the lines are blurred between personal and professional lives. Some care settings that nurses work in are more vulnerable to the professional boundary crossings and violations. Some of those are the care settings where we spend a lot of time with our patients and our families, such as long-term care, home health, and hospice. Professional boundary crossings can be harmless, inadvertent, and thoughtless behavior. They're not really meant to hurt anybody. They just happen over a normal relationship with our patients. But they need to be watched. The nurse needs to watch their behavior and in respect to the relationship. The nurse-patient relationship can return to a normal role and behaviors. Although a professional boundary violation is a harmful situation, it is revealing of personal information to our patients, which can cause empathy to the nurse, and those violations are typically cause a reversal of role, the patient-nurse role. Sexual misconduct is another problem and within the nurse-patient role. And all these examples, they can lead to unplanned relationships, intimacy, personal benefit, emotional needs of the nurse, and monetary gains. And the nurse needs to continuously ask themselves if they are crossing any boundaries and do a sort of personal check. Some red flags that should come up that the nurse needs to be able to identify would be conversation pieces such as discussing personal issues, discussing staff and hospital, staff and employer, favoritism, extended care time, and keeping secrets.
Knowledge will be key. Nurses need to practice in a manner consistent with the professional standards. There are several places that nurses can go to get additional information to remain knowledgeable with professional boundaries and maintaining the standards and codes of ethics, such as the American Nurses Association Code of Ethics for Nurses, which discusses standards and codes of ethics. The American Nurses Association Code of Ethics states, when acting within one's role as a professional, the nurse recognizes and maintains boundaries that establish appropriate limits to relationship. It says it's every nurse's responsibility to become knowledgeable regarding the prescribed professional boundary guidelines. Understanding of and compliance with these boundaries allows us to best serve the public during all professional nursing interactions. Another place that the nurse can go to get additional information is the National Council of State Boards of Nursing, Professional Nurses, which is a nurse's guide to the importance of appropriate professional boundaries. There is videos and online courses that can be taken and viewed at this site. Employer policy, knowing your employer's policy and having the compliance department having access and pursuing information from your employer's policies and compliance department would be very beneficial in maintaining professional boundaries and your knowledge of them. One additional piece, the timeline and termination of a relationship. Being able to not only maintain respect, rapport with your patient, maintain boundaries, but it's a situation where, we have to be responsible of, after the relationship terminates, that we are enforcing and maintaining that boundary after the care. Reporting. Nurses should remove themselves from the situation or request assistance from their supervisors or, like I'd already mentioned, their compliance department if they see any questionable behavior or are involved in a situation that is questionable, they're not sure about. Report it. Make sure that safety of the patient is maintained, because that is our primary focus. Make sure there's no issues. Legality issues, things like that. Just make sure that those things are taken care of.
And education. Education begins in nursing school. It is a continuing education all the way throughout your career. It can be through employer education during orientation, annual competency, or as needed initiatives. There's also self-guided education. It's important for the nurse to stay knowledgeable and being able to identify their own actions.
Employer education, the annual competencies, being self-guided, remembering your HIPAA compliance, making sure that you're knowledgeable in regards to that.
Okay. And consequences. There are several consequences that can happen for any crossing or violation. There's an employer discipline, which could include termination classes, verbal or written warnings. There's also state board suspension, additional classes or refresher courses, or even loss of license. There's also legal problems with the local and state police. You could be looking at fines, jail time, or criminal charges. Also, something else to consider, especially with social media, is HIPAA violation, that you can be fined for HIPAA violations.
And lastly, we'd like to ask you, classmates, how does your employer provide education on professional boundaries? Thank you so much for your time.